Welcome and good morning, everybody. Welcome to the campus COVID-19 briefing. We know there are a lot of questions in our community, and we wanted to take this opportunity to share information and address concerns just before our semester starts on Monday. Please note that live captioning and ASL translation are available, and that a recording of this event will be posted later today up on my website. Today we'll be going to about 10 a.m. We'll get to as many questions as we can, and you can ask questions using the Q&A function. Today, we're joined by Provost Susan M, Vice President for Student Life Martino Harmon, Chief Health Officer and Infectious Disease Physician Preeti Malani, Associate Vice President for Human Resources Rich Holcomb, Dr. Rob Ernst, a physician who leads our Campus Health Response Committee and is Associate Vice President for Student Life, as well as Executive Director of the University Health Service, and Emily Martin, an Associate Professor of Epidemiology in our School of Public Health, and a member of our Campus Health Response Committee. As I've mentioned, we've heard a lot of questions from our community, and many center on safety in our classrooms and how we're thinking about the fall semester. So I'd like to first bring in Dr. Ernst and Dr. Malani to discuss some of these questions, and then afterwards I'll turn things over to Dr. Malani to pose more of your specific questions and concerns to the other leaders. I'd like to start out with a broad and almost philosophical question, and then move to some more specific issues. Earlier this summer, it looked like COVID-19 was on its way out. Vaccines were widely available, and both the Pfizer and Moderna vaccines were 95% effective in preventing COVID-19. The number of new cases here and around the United States was dropping quickly. We thought that breakthrough cases of COVID-19 amongst vaccinated persons would be vanishingly rare, and that it was unlikely a vaccinated person could transmit COVID-19 to another person, especially one who was also vaccinated. We were predicting a much more normal fall semester, and then perhaps even the absence of significant amounts of COVID-19 by early 2022. Now, these predictions appear to have been too optimistic. The Delta variant of SARS-CoV-2 is much more infectious, and the vaccines are somewhat less protective from infection than we had thought. While vaccination rates here on campus are quite high, with 92% of students, 88% of faculty, and 73% of staff fully vaccinated, and masking required for all persons indoors on campus, there's still concern among some faculty and staff about whether it's really safe to return to in-person instruction or work. People with children at home who are too young to be vaccinated, or with people in their households that are immunocompromised, are particularly concerned. How do you think about the evolution of the COVID-19 pandemic? Where are we now? How safe will our classrooms be? Will anything be much different next year? I'd first like to turn to Dr. Malani. Preeti, as I said earlier, is an infectious disease specialist and has been caring for COVID-19 patients here at Michigan Medicine since the pandemic began. She's also an editor of JAMA, a major medical journal, and has written extensively about COVID-19. Preeti, what do you think?
Thank you, Mark. So first of all, just a quick welcome to our students, and especially those who are new to our community. We're really happy to have you and your energy. So, it's really been a year and a half of uncertainty, which I think creates a lot of anxiety for some. And, up till recently, myself included, many of us were sort of holding out for this magic moment where things were going to return to normal. And what I have seen and really kind of learned to accept, and others are talking about this, is that SARS-CoV-2 is really transitioning to endemicity, this idea that it's going to be there alongside us, but we're going to learn to adapt and be flexible and approach it, and really getting back to everything we need to safely. And what is very clear, what is not uncertain at all, is that vaccination is the best way to get there, but it has to be widespread vaccination. And again, the numbers that you shared, I just want to emphasize, those are partial. We're still waiting, especially on this faculty and staff, to get more numbers. I mean, the feeling is we're going to be higher than that, and we're about 99% in the res halls, which we'll talk about. But something that gets lost in all of this is that this is a novel coronavirus, and that there is not prior experience, unlike influenza and other viral illnesses, and that as the pandemic changes, our approach has to change. And right now, as you mentioned, there's a lot of churn, and I think that even by coronavirus standards, and there's some discussion around uncertainties, the Delta variant, and the vaccination issue, which you mentioned. And I just want to say, I remain very, very optimistic for our future. There's some concern right now about waning levels of protective antibodies, but what we don't know is that there are unmeasurable things we don't normally measure that still appear to be quite protective, and that against severe infection, hospitalized, the people I end up seeing, vaccination remains highly protective. Despite these uncertainties, I would say that the communities that are highly vaccinated, including our own, are really going to be poised to be the least disrupted. It doesn't mean we're going to have 0 cases of COVID. It just means that we're going to be able to continue on in a way, and we're not going to have people getting severely ill. And I will also point out that Michigan as a state continues to do well. I know there's a lot of like this percentage increase and that, and we have, of course, my friend Emily Martin to help us make sense of those, but look at the rate overall per 100,000. We're among the bottom in the United States for cases, for hospitalizations, and for deaths, which is really welcome news. So moving forward, I would say that the risk isn't going to be 0, but it will be very low. And again, on our campus, we've really had a lot of discussions on how to make it as safe as possible. And I know Rob can chime in on a lot of this, but with masking on top of high vaccination rates, the risk is as close to 0 as you can have it. And I'll end by saying we're not powerless against this virus. We know what works. And masking is really important short term, but long term, vaccination is the end goal.
Thank you, Dr. Malani. Rob, in particular, would you discuss something Preeti alluded to, our sort of layered approach to health and safety, and any thoughts you might have of where we are now?
Yeah, thank you, President Schlissel. And I'd again add my welcome to the students back to the campus, and for the new students, we hope that we can give you the really vibrant Michigan experience that you're hoping for. It resonates with me, this notion that we had a lot of optimism earlier in the summer. Last year we were working like crazy to build systems and figure out this menu of different mitigation strategies to kind of manage the pandemic, and allusions to or metaphors of building a bridge while we're walking on it, and building an airplane while we're trying to land it, that sort of thing, have evolved now. And earlier in the summer, the vaccination looked like it was going to really push us to a very, very different kind of place. And there was times in May and June where the rates in our surrounding community were at levels that were originally labeled post-pandemic. So that's what everybody had been hoping for, was to actually get past the COVID pandemic. And I think the emergence of the more contagious variants, at the same time the emergence of the Delta variant, as we were relaxing masking strategies indoors, made us realize that we have to kind of refocus and create systems that allow us to move our mission forward in the context of having COVID around us. And during that time when things were really feeling different, we were focusing, at least in student life, on really exciting things like a joint task force with Student Life and the academic affairs partners on student well-being, and identifying important issues of building community and isolation that's impacted students. And I think that's really become the shift. Instead of just trying to sort of wait out the pandemic, it's how can we keep moving towards some of our important mission critical efforts in the context of the pandemic. So we have also new information. Last year was chaotic for many. We recognize that. Anxiety provoking, as Dr. Malani had alluded to. But now I think we've learned an awful lot. And when I say we, I mean the entire public health community. The Centers for Disease Control has developed a lot of really comprehensive resources for institutions of higher education, either for those that have high degrees of vaccination like ours and others. The American College Health Association has been following this very, very closely in a very conservative way to outline some of those strategies. And what has brought this latest wave has been this combination of higher infectivity and some behavioral change. So as we measure and track the activity around us, we can impact both of those. So the vaccine is clearly the single best way to address the infectivity. But for the behavioral things, based upon what we know, we flex the expectations around masking. We had thought that the target of 75% vaccination would have been sufficient to relax masking strategies indoors, and we've pushed that back, and I'm glad we did. I'm really glad we pushed for this mandate for all of our affiliates to try and give us the best chance to move into the semester with that Michigan experience that our students really want and expect.
Let me ask you again also, Rob, are we asking students coming to Ann Arbor to quarantine or any subset of students? How's that working this year?
Yeah, so we do have a very high degree of vaccination, as was pointed out. There are some students who just don't have access to the vaccine where they are. These are some of our international students. So we have worked very individually with the students that are coming from international areas and have not had access to vaccine to quarantine for a week before they socialize into our areas, including the residence halls, and they'll have a test in that time as well.
Good.
Testing remains present as one of our strategies. We have the expectation that anyone who's granted an exemption from the vaccine mandate be tested weekly, and we have our CSTP sites available for that. It's available to others if they are interested voluntarily for the testing, and then our containment resources for case investigation, contact tracing, quarantine, and isolation are also available. Again, this is part of that layered strategy to, as we identify cases, mitigate the spread around those cases and remove those folks from our spaces while we think they're infectious.
Thank you. In an effort to drive as a higher fraction of our curriculum to be in person as possible, we've relaxed social distancing guidelines in our classrooms and our labs. What are your thoughts? How do you think about safety in the setting of more normal distancing between individuals?
I can comment on that, and maybe Rob can chime in. And again, these aren't things that we sort of come up with on our own. These are things based on guidance from the CDC, based on new evidence. And again, the social distancing guidance actually allows us to think about getting back to a lot of things in person. And as you know, in the labs, this requirement, the labs are at full capacity, have been without any problems. And the health system has continued to be like that as well. But because we're highly vaccinated, and I mean really highly, in the 90% plus range, we're able to drop some of those distancing requirements that were in place last year.
Yep. And Dr. Ernst, how has the exemption process been working? How do the requirements work? What fraction of students have approved exemptions? And can we share that number up for the community to give them some sense of where we are?
Yeah, sure. Vaccine mandates aren't new for us. As a healthcare provider, we've had influenza vaccine requirements every year, and there's a variety of other safety profiles for those at risk. So the Occupational Health Services office at the university here has established protocols for evaluating exemption requests for medical or religious based. And we've partnered with those folks in occupational health as well as HR to create teams for reviewing vaccination exemption requests for religious or medical reasons. We, at this point, for the students at the Ann Arbor campus, it's about 1.5% of the students are in the process of working through those exemptions. It's not so simple as a review and an approval, in that the request for medical exemptions requires that the individual provide some medical documentation. And for the religious exemption, there's some educational materials that we expect that they review as well. So there's some time that is taken before they are fully adjudicated. So we're in the process of managing those requests.
So if everybody was fully compliant, then we'd be somewhere between 98 and 99% vaccinated as a student community.
Yep, and we're approaching that. We have, what the number that's posted on the dashboard now is 92%. That's based on a fixed denominator that we had a strong interest in our community for sharing that information early on, and we've been doing so. But we used a 5-year rolling average of what we thought enrollment would be. So we haven't known what enrollment's going to be. We're going to know a lot more about that next week, and we may have to make some adjustments in that. But there's a chunk of, another 3 or 4%. They're actually in the process of getting fully vaccinated. We announced the mandate just 4 weeks ago. So if somebody started at that time, they won't be fully vaccinated for another few weeks. And we have a lot of students in that category as well. There are some that we're still tracking down. And those are folks that we know about, and we've engaged the academic partners are going to hear about it. And it's going to be very difficult for them to function as students in our community if they don't work with us to either give us their vaccine information or request an exemption.
Yeah, I'm particularly heartened that we're at 99% or so in our residence halls, which means that life in the residence halls will be, really quite normal, at least to start the year. And as we've discussed, we're not requiring masking for residents in their own residence halls. The communal spaces will be open, and it's because of this 99% rate. It's really fantastic. So thank you both, Rob and Preeti. And I also want to thank the Campus Health Response Committee. We call it the CHRC amongst the leadership here. But this group of colleagues from many parts of the campus, led by Rob, have been working triple time ever since March of 2020, really, or April of 2020, trying to keep ahead of or keep up with the evolving pandemic. And they've done yeoman's work, really spectacular work. So my personal thanks again. And let me turn the microphone over to Dr. Malani, who will host some questions from the audience for particular campus leaders.
Great, thank you. So we're going to start with Provost Collins, and I know that there are a number of very specific questions here around what classes will look like. So I'm just going to begin here. Provost Collins, how were decisions made about what classes are online versus in person?
Yeah, thank you and good morning, everybody. But before I turn to that first question, I just wanted to very briefly make a comment. And first, just how wonderful it is to welcome our students to campus for what will be primarily a residential fall experience. I've had a chance to talk with many of you, and the excitement is just contagious. It's really wonderful. While we've certainly learned that technology can enhance the academic experience in many ways, we really value and understand the importance of the in-person engagement for the most effective teaching and learning. And I also wanted to just mention very briefly that we recognize that for many of our faculty and staff, especially those with young children, the context does continue to be challenging. And in particular, we know that research progress disruptions are ongoing for a number of faculty members, and we'll continue to explore ways to address the implications of that. So in terms of the first question, schools and colleges led the decision-making about our course modalities. And course modality, of course, is whether a course is taught in person, hybrid, or remotely. And those decisions focused on pedagogical considerations and programmatic needs. And the focus really was recognizing that the university, as I mentioned, was returning to a primarily residential experience for our students. And there were some space constraints that had to limit our ability to put at least a small number of classes in person. So as you've already said, while there never will be zero risk, we're in such a different place in terms of safety that it just makes sense to return to a context where decisions about our courses, where our courses are taught, their modality, are programmatic decisions at the unit level, not simply instructor choice. We've learned how safe our classrooms are, and especially with the extremely high vaccination rates. So it really has been important for us to transition back to the general expectation that our instructors are available for on-class engagement. Of course, we continue to have the policies and procedures to address any who have special health needs.
Yeah, thank you. And I just want to emphasize that one thing we learned last year was that classrooms are safe, in fact. And again, that was with masking. We didn't have vaccination last year. So speaking of which, how should instructors handle students who don't mask?
Yeah, so we expect this will be really rare, but there are a number of things that instructors can do if that situation arises. So the first step really would be just to directly remind the student that university policy requires everyone to mask indoors. And in the unlikely event that a student in a class still refused to comply after being reminded politely, instructor could ask that student to leave the class. And if the student still refuses, the instructor can leave and cancel class for that day. Now, of course, that would be a step that you'd only take as a last resort. And it would be important to inform your department, the instructor's department, or the dean's office if something like that arose. And I also want to mention that our Statement of Student Rights and Responsibilities says that any member of our university community, whether faculty, staff, or student, can submit a complaint or request for conflict resolution services through OSCR, which is our Office of Student Conflict Resolution. But again, we would expect this to be very rare.
Thank you. Will instructors be provided with information about student vaccination status?
So as I have already said, the university policy at the moment is that all individuals, whether they're vaccinated or not, are required to wear a mask indoors. And that mask requirement, of course, includes classrooms. So as such, our instructors won't receive information at the start of the semester about the vaccination status of students. Our measures to enforce the vaccine mandate, which we'll talk about, those are being handled centrally and by the schools and colleges, not by individual instructors. But if we are able to change our indoor masking requirement, then we will be ready to provide instructors with vaccination status information for those students who are enrolled in their courses. And the purpose of sharing that information would be to help ensure that masking is maintained for those students who are not vaccinated, those with exemptions, et cetera. So instructors should not otherwise treat unvaccinated students differently from vaccinated students. But faculty certainly can ask to see the responsive blue screen of students who are in their classes. And everyone should check this daily, should complete it daily, I should have said, if they're on campus. And you'll get a green check mark, of course, if you're complying with university policies.
And then finally, something that many people are interested in is, what is grading like for this academic year?
So when we returned to having most classes offered in person for this fall, we are also returning to the traditional grading system. So we're discontinuing the option to convert a passing grade to a pass, and will no longer use the no record COVID or NRC grade. Yet we do recognize, of course, that the pandemic continues to create stress and uncertainty for students. So in a response, we're temporarily suspending, or extending, I should say, a more flexible withdrawal policy. And that will allow undergraduates in any school or college to withdraw from a class at any time up until the last day of class. One difference, though, from previous policy is that if you withdraw from a course after the drop add deadline, it will appear on your official transcript with a W grade. So the idea here is that we're empowering students to make informed decisions about whether they would like a grade recorded for their class or to have a withdraw and have a W. Courses that are already ended or have been already graded, of course, can't be dropped. And then for our graduate and professional programs, including Rackham programs, they will also return to regular grading systems for this term. And additional flexibility for course selection and for withdrawal policies, that's determined by each program's governing faculty. So much more normal semester in many, many different regards.
Thanks, Provost Collins. We next bring in Vice President of Student Life Harmon.
Good morning.
Welcome, Martino. And I just, as we get started with the questions, I just want to send a personal thanks to you. I actually texted you last night to just say what an amazing job you and your team, as well as DPSS and everyone, has done to get the students moved in and safe and really engaged with campus. It's just amazing. So thank you for that. And speaking of which, what events do you have lined up to help students find community this fall?
Well, thank you, Dr. Malani. And first, I do want to mention that really all credit goes to the team and just a number of people that have worked really hard to get us to this point, to a great semester and a safe semester. And I want to welcome all of our students as well as the university community. I'm sensing a lot of optimism and excitement as people are trying to be safe. So to answer the question about events, we've got a lot of great opportunities for students to make friends and to get to know campus this fall, starting off with our welcome home programming. And there's an app that illustrates all of the different programming. But I'm just going to mention a few what we call anchor events. Convocation is this Sunday. It's the formal kickoff to the fall semester. That'll be in the big house. So I'm really excited about that. There's an event called Artscapade. If I said that 3 times, I'll probably mess it up. But that introduces new students to arts participation on campus through art making, music, dance, poetry, you name it. Then there's Escapade, which connects new students to the Michigan Union, showcasing co-curricular involvement opportunities and just cultivating community. It's a lot of fun. I'm going to try to make all of these events. And then Festifall is an annual student organization involvement fair for new students. And we're also emphasizing the opportunity for second-year students who didn't have a normal first year to connect with student leaders, get involved, and discover community. And just 2 other things I'll mention quickly. I really recommend checking out the Party in the Park at Ann Arbor Burns Park. This event will be fun. It'll be an afternoon of free food, music, games, prizes, and connections to campus resources. And finally, I'll mention to get ready to show team spirit, go blue, there'll be a student kickoff rally in the big house, which invites students to practice game day traditions and cheers and songs to start the 2021 football season. I can't wait for that event.
Yeah, that sounds great. I'm just going to put in a plug for the UMix programs too, which are going to be occurring in the coming days, I think on Saturdays mostly. And I would just say to the students and to any parents who, happen to listen in, to tell your students, take some risks socially. And I don't mean like bad risks, but like go knock on someone's door, go put yourself out there, because I think everyone is feeling a little bit anxious after being a bit isolated. And that gets to our second question. What about the second years? What are some of the second year focused events, Martino?
Absolutely. We put a lot of effort, Student Life partnering with new student programs and academic affairs. And I want to first say welcome to our class of 2024, our second year students. We're excited to have you here this fall. And we know that it's been tough trying to make new friends and find your place at Michigan during the pandemic. So we've got a great selection of events throughout the beginning of the semester to help you get used to campus life and to meet friends who might be people you'll keep up with for your entire life. So I would again recommend the student convocation in the big house this Sunday, and don't forget to hang around for the post-convocation picnic afterward. That'll be a lot of fun too. I also would recommend our second year students to check out the Student Traditions and Tours program. I actually signed up for a tour this Saturday, coming here during a pandemic. I'm really looking forward to a tour and learning all of those traditions. So I'm signed up for that. Tomorrow we'll have the sophomore celebration on Ingalls Mall, and that'll be an ice cream social for sophomores where you can receive giveaways and sign your class banner. How cool is that? And then finally, we also have various off-campus neighborhood gatherings for second year students. And I could go on and on. You mentioned UMix. There are many, many different events. But in the essence of time, I just highlight a few.
Yeah, thank you. And it's funny, is you're actually a second year student in a way.
I am, absolutely.
And you mentioned
Absolutely.
that, and when we met earlier in the summer, I took a walk with my puppy, and you mentioned that no one had ever really given you a tour because you arrived here in the midst of sort of the shutdown. So I'm glad that you're going to learn the traditions too. How are you enforcing the vaccination requirement? I know Dr. Ernst touched on this a bit, but if you can recap.
Certainly, and with public health guidance and a community effort, we're going to be enforcing that for sure. We sent out guidelines earlier in the week, so check your inbox, students, for an email from me. But I'll give a brief overview here. Any student who is not fully vaccinated by August 30th will be required to get tested for the weekly COVID-19 test until they are fully vaccinated. But this also includes students who are not fully vaccinated for any reason, including being partially vaccinated and or students who their last dose of vaccination was less than 14 days ago, and students who have approved exemptions or temporary postponements because they're waiting on a response. So all of those categories, if you're not vaccinated, you'll be required to participate in the weekly COVID testing program. Students who haven't reported their full or partial vaccination or submitted a request for an exemption or temporary postponement by the August 30th deadline will have an administrative hold placed on their account. The administrative hold on your account will prevent students from dropping and adding classes, from future term registration, transcript release. So we're really trying to get your response so that we can keep the community safe. Also, students who don't take appropriate steps to stay in compliance with the vaccine and testing policies could be subject to other accountability measures. And that's primarily under our Statement of Student Rights and Responsibilities Addendum. And it's really about safety to the community. So I encourage you not to wait. Hold yourselves accountable as Michigan Wolverines and show us that leaders in best spirit that will keep the community safe. And if you're still unsure about getting vaccinated, I recommend talking to an advisor about the vaccine safety. You're hearing about it today, and get more information so you can really make a good, safe decision.
Yeah, and again, we've heard from almost everybody, and especially in the residence halls, and the University Health Service has been filling those appointments with the advisors, and I think that's been really helpful for some students making their decisions. Speaking of masking, we talked about the classrooms with the provost just now, but how are you going to enforce the masking policy during move-in and throughout the semester?
You know, actually, over the last couple of days, I've been dropping into some of our halls for move-in events, and I've been really pleased to see that parents, family members, and students are really following the masking policy during move-in. And I really feel as though people want this to work. They want it to be a success, and they're following those policies. So that is really good news from what I've seen thus far. But if that doesn't happen, whether it's during move-in or throughout the year, I would again encourage people to provide a kind reminder of the policy. And university community members who provide services can deny services to anyone for not complying with the university's face covering policy. For repeated non-compliance, you can notify a campus leader or a staff member. For example, a housing hall director, dean of students office, a chair, director of a different department, and so on. And if it's a complaint related to student organizations, a complaint can be filed through the Student Organization Advancement and Recognition process that we call SOAR. And the great thing about that is a process that involves students in a self-governance mechanism. So that is managed by the Center for Campus Involvement. So we hope this won't be necessary, but we know there'll be some instances of repeated violations of this policy. And in that case, the issue can be escalated to the conflict resolution through OSCR as part of the Statement of Student Rights Addendum.
So thank you very much, Martino. We next bring in Vice President of Human Resources, or Associate Vice President for Human Resources, Rich Holcomb.
Good morning.
Welcome, Rich. It's good to have you here. And just like we've talked about students and we've talked about classrooms, let's talk about staff more broadly. What are the disciplinary actions for those who don't get the vaccine, and will everyone who doesn't get the vaccine face the same disciplinary action? These are some of the questions that a lot of folks are asking.
Yes, thank you, Preeti. Good to be here this morning, and welcome back everybody to the beginning of the fall semester. Very excited, and as we've talked about, our commitment and focus is really on the health and safety of our campus community. So we developed a work group that really focused on a set of principles that would help and guide our enforcement strategies. And at the very top of that list is the health and safety of our community. And really, it's again about providing education and information. So the first step in the process is if somebody is not vaccinated by August 30th, we're going to first start with education, reminding individuals of the advisor call line to get questions answered about the vaccine if they have concerns, to help guide them in that decision-making process, remind them of the requirement to get vaccinated. And really, it's an important step in, again, trying to move individuals to get vaccinated. So with that first step, education, a verbal warning will be issued to the individual. And then if an individual continues to remain non-compliant with the vaccination status, to occur as a follow-up, the next step would be additional disciplinary actions and enforcement measures that would take place. So after the warning, anybody who remains unvaccinated or not compliant will face a disciplinary layoff of 2 days without pay. Professional development and travel will be restricted. Restrictions will also apply to faculty funds for professional development and discretionary funds, and they may have sabbaticals delayed and lose eligibility for honorific recognitions from the university. Both faculty and staff who are out of compliance will be ineligible for next year's merit program. And so what we're really wanting for people to do is really seriously get vaccinated to protect our campus safety. Those individuals that continue with non-compliance with the vaccine requirement or other measures, testing, masking, daily screening, the symptom checking, may lead to additional sanctions as well, including potential dismissal. Our focus, though, really is on safety and not discipline. We really want to have individuals get vaccinated, but we recognize discipline may be necessary to achieve the campus safety that we're striving for in our community.
Yeah, thank you.
Thanks very much, Rich. We'll next bring in Professor Emily Martin from our School of Public Health. Thanks, Emily.
Hi, thanks for having me.
Hi, Emily. Boy, what a time to be a respiratory virus epidemiologist. Thank you for everything you've done for all of us, not just the campus, but really for our state and for our nation. So I'm just going to start with a question that a lot of people are asking, which is from an epidemiologic point of view, are the vaccines effective given what we know about the Delta variant?
Excellent question. So this is something that we've been monitoring closely. First, I wanted to start with an infographic that a team of us at School of Public Health has put together. What we're looking at here is looking at different scenarios around vaccination. On the left, we see the scenario that we see in many communities around the state where we have closer to 50% vaccination. And you're going to see a lot of cases, particularly in the unvaccinated group. A lot of cases, both in the unvaccinated group, and then a lot of prevention of cases due to vaccination in the vaccination group. If you look at the right side, the 90% of people vaccinated, and in contrast, this is the scenario that we are hoping to see on campus with a highly vaccinated population. Amongst our students, we're already higher than this 90% mark. And what we're showing here is that we've got a much smaller group of unvaccinated people that will have a higher risk of infection. And then we're going to have a much larger group of vaccinated people with a much lower risk of infection. So, anytime you've got a vaccine effectiveness that is lower than 100%, you're going to have some cases in both groups, but you have a large number of cases that are prevented in the vaccinated group. And so this is what we're going to be tracking here on campus. So to go back to answer your question more directly, the U.S. is monitoring this nationally, including efforts that we're participating here in partnership with Michigan Medicine and at U of M. And obviously, we're getting data in from a lot of other countries. Vaccine protection is very strong against hospitalization, 80% or better, including against the Delta variant. The latest data on protection against symptomatic milder disease includes 2 very large studies from the UK and recently from New York State. They show the vaccine preventing 70% or better of symptomatic disease. Interestingly, the study from the UK included a direct analysis of protection against the Delta variant by using sequencing methods and found results in the 80s against protection against symptomatic disease. Now, this is down from the 95% they saw in the original trials, but it's still very, very high. It's still very good protection. We are seeing some evidence of small changes in protection are waning over time, and this is where you're seeing conversation about booster doses. As that data crystallizes, you'll see the conversation on booster doses sort of move forward to address that specific concern.
Thank you. I just like 2 comments, maybe. One is just what we're seeing in our hospital. I feel like I have to say this, is that we're not seeing people who are hospitalized for COVID specifically who are young and healthy and vaccinated. They may have underlying health conditions. They may be there for different reasons, but we're tending to see people with advanced age organ transplants. And fortunately, we're not seeing a lot of children at this point. Obviously, we want everyone getting vaccinated, but I think that there is a sense when we look at those percentages of people vaccinated, and Emily, you're like the total numbers person. You're like the queen of numbers. But that we got to look at absolute numbers, not just that, oh, it's gone up 100%. And I hope people can understand that, because as she explained, in a highly vaccinated community, that portion is going to increase, but it doesn't mean that things are falling apart. And so that's good news. Can you give us an update? This is really important, on the new campus response metrics. And you've been tracking this for a long time, but what sorts of things are we measuring that might lead us to pull back or add other mitigation, even remote classes?
Yeah, great question. And also kind of speaks to your last point too. So metrics for this fall semester, we're continuing to review and update these metrics as we learn how to do this in a highly vaccinated population. So one thing we'll be doing, which you just mentioned, is we're going to be tracking the rate of cases in the unvaccinated group and the rate of cases in the vaccinated group to kind of replicate that figure I just showed, so we can monitor and start to estimate the difference between the two groups and watch for any concerns there. The other thing that we have the benefit of having this year is the CDC now has a system for tracking community spread metrics. It takes into account cases in the county. It takes into account percent positivity. So we don't have to make that algorithm on our own. We can align with the CDC algorithm. The other great thing about this is that that comes with CDC, that comes aligned with recommendations at each level of spread that we can align with as well. So we're going to use those recommendations as well to follow. And actually, you can look at those numbers on, you can go to mystartmap.info to see those numbers directly on the community transmission numbers. It's a website run by School of Information, School of Public Health, to bring those numbers to you. Other thing that we're going to be looking at closely is doing more about calibrating, understanding what's going on at UHS, at Michigan Medicine, to make sure that we've got clinical capacity to continue to provide enough care for people. So those are the types of things that we're tweaking, and those numbers will be tracked throughout the semester.
Yeah, thank you. And last year we talked a lot about, we kept track of quarantine isolation housing and the amount of time it was taking to do contact tracing. And again, it's a lot different in a highly vaccinated population. And as I mentioned in my introductory comments, that when you're really vaccinated, you're least likely to be disrupted by these things. So lots of optimism in this. How is this fall going to be different from last fall with the new variant spreading, even in vaccinated individuals?
So I hope it will be different. I mean, we do have Delta variant to contend with, which is more highly transmissible. On the other hand, we have a very highly vaccinated population, as you mentioned. So I'm hoping that means that outbreaks are fewer, outbreaks are smaller, and that the balance will have the balance on the vaccination side to mean that we're reducing the total number of infections, the total number of illnesses, but we're also reducing the severity of the illnesses that do occur.
Absolutely. And can you share some more details on the wastewater monitoring program? Not everyone knows about this. I find it fascinating. So if you could tell us about it.
Excellent. So this is actually building upon a wastewater monitoring program that was happening last year as well, that we were using data from. So researchers at the School of Public Health and College of Engineering are expanding the existing wastewater monitoring programs to include both looking at more sites on campus and looking in the surrounding community. So looking at sites in Ann Arbor and Ypsilanti to see what's going on in the wastewater around campus as well. This program is growing. I hope it's going to be useful to monitor COVID-19 patterns. The other thing it's going to be useful for is in scenarios where you have really low numbers and the case data may not give you a full lens on what's going on. Wastewater is an excellent supplement to that data stream. And so really looking forward to being able to use that to help make campus safer as well.
Yeah, the other day you showed us a graphic and it was amazing. Like it really tracked the waves that we were seeing. And again, it's one of many pieces. So thank you so much for all you do, Emily.
Excellent. And I think there was a question in the Q&As about the website I mentioned for community. So we do campus metrics go on the Campus Maze and Blueprint. And then community metrics are at MyStartMap, MyStartMap.info.
Emily, before I let you escape, I want to go back to one of the questions just to make sure everybody hears and understands. You mentioned the metrics we're going to be tracking to make sure things don't get out of hand. But what are some of the responses that we can implement when we do see clusters of infection, or we're worried that we're approaching the capacity of our quarantine or the capacity of our healthcare support? People tend to think of this all or none based on the dramatic events of the spring of 2020, where all of society was locked down. But obviously, there are many steps in between where we are now and pulling back to where we were in 2020. Can you talk about those briefly in the context of the campus?
Yeah, I mean, I think where we start is a lot of our current tools can be scaled, right? And so we are doing a lot of testing in unvaccinated people that can be expanded, it can be changed, it can be moved into different communities. As we did in the fall, what we often did was when we saw particular groups of students we were concerned about, we would ramp out testing those groups. We've also done a lot of work to increase the accessibility of our testing sites, and we're continuing to do that. And so, we've still got that tool available to us on top of the vaccination tool. Masking is another thing we can think about, changing mask guidelines and continuing to increase our masking policies in different places if we need to. And so if you think about taking our current strategies, we can ramp those up even more before we get into thinking about ways to de-densify spaces.
Very good. Thanks very much. And thanks again, Emily, for all the work you've been doing and continue to do. We were joking earlier today, this is your sabbatical semester, right? So this is what an epidemiologist does on sabbatical. But thanks very much.
Thank you.
So I'm going to turn things over to Preeti to moderate questions that have come in recent days, and then turn to questions that are coming in real time. So Preeti, back to you, and we'll bring our colleagues up on the screen as well.
Yeah, absolutely. And President Schlissel and I are going to tag team a little bit because a few of us we're kind of running in different spaces, but I'm going to start with the second question here for Provost Collins. Can you provide information on ventilation in classrooms?
Yeah, and that's actually a question that I've heard a lot. So the university has very high HVAC standards in our campus classrooms. Our HVAC systems are designed to meet or exceed the Michigan Building Code, known as the MBC. Those are requirements for airflow at maximum space occupancy. Of the more than 500 classrooms or designated spaces on our Ann Arbor campus, there are only 3 that are known to lack mechanical ventilation. And all of our classroom spaces, except these 3, have a MERV 13 or higher air filter, which is the University of Michigan standard and meets CDC recommendations. And of course, for those 3, we're taking additional countermeasures to address any concerns. In preparing for the fall semester, our facilities and operations augmented its routine procedures for maintenance. And that included additional inspections in all of our classrooms to make sure that the HVAC systems were operating properly. They've disabled the demand control ventilation, those controls that reduce the air supply, such as occupancy sensors. And those have been disabled in our academic and research facilities. Again, that follows CDC guidelines, and it provides additional ventilation inside the buildings, even in spaces that are unoccupied. And then we've extended the HVAC run times. So before and after the operating hours to provide additional daily air changes. And we'll just keep continuing to monitor our HVAC systems performance and the ventilation in our classrooms across campus. So we're really doing a lot in that space, and we're quite focused on it.
Thank you. So I'm going to go back to question 1. A friend is resisting vaccination because of not trusting large pharmaceutical companies. Do you have any suggestions on how to respond? And I'll toss this to President Schlissel to see what he has to offer.
Sure, that's a great question. And I think it's a really valid question. Drug companies have a vested financial interest in people using their products, using these vaccines. And although the drug companies are said to be doing the vaccine programs at cost, who knows what's really going on? So I think that's a really valid concern. But that's why we have an independent FDA, Food and Drug Administration, that requires extensive testing of vaccines. First, there was this emergency use authorization, and more recently on the Pfizer vaccine, full authorization of use. That involves the companies submitting reams of data, and government experts as well as outside expert panels look at this data. So by this stage, these vaccines have been very thoroughly vetted, not just by the company itself, but by the Food and Drug Administration and outside experts. And if you want more reassurance, hundreds of millions of people have received these vaccines in our country and even more around the world, with tracking of outcomes showing tremendous safety and effectiveness. So valid concern initially, but mechanisms are in place to make sure these vaccines are safe.
Thank you. And the next question I'm going to toss to Rob Ernst. What is the procedure for in-person classes if a student in that class tests positive for COVID-19?
Yeah, this is I know, a really important question about how we're going to do containment. And our containment strategies are developed in consultation with our really strong partnership with the Washtenaw County Health Department. You know, we are really advantaged by our relationship with Washtenaw County. We had a meeting this week with the health director and the medical director, and you know, they're responsible for the investigation and containment, and they're really worried about, you know, K-12, but also higher ed, and want to make sure there's a consistent approach. In our environment, every case will still be investigated, and as part of the investigation, that person will then be isolated and close contacts will be identified, and then those folks will be a determined level of risk. And at this time, vaccinated individuals, based upon that really compelling evidence shared by Dr. Martin, will not be expected to quarantine if they are asymptomatic, and testing will be available to them. The classrooms will be notified if it's determined that somebody who tests positive may have been infectious at a time. And this is sort of a practice that's standard. You know, I remember a couple of years ago when there was a case of measles that had been in a childcare area at a gymnasium or something, and they notified all the members of the gymnasium, said there was somebody there. If you think you're at risk, let us know. And that's the purpose of that, is to notify people who are in the classroom. And if there are people then want to seek testing, that'll be available to them. So that'll be the approach, and coordinated with the health department.
Yeah, and you know, unfortunately, there are going to be cases where this happens, and I think, you know, again, like just channeling my inner Rob, like everyone just has to stop, take a breath, and let's like go through the process. And I'm actually going to hand off at this point to President Schlissel to talk about the Michigan medicine questions that came.
Sure, thanks very much, and thanks for your help today, Preeti. I know you have to escape a bit early. So a question came in of Michigan Medicine issuing guidance that there should be a pause in returning to office on September 13th, which is what they initially planned. Is the university planning on issuing the same guidance? The answer is no. You know, the Michigan Medicine is making decisions based on their local needs, as are our schools and colleges, based on the nature of the work that people do and the need that that work be done in person in order to be done effectively. As you also know, we're experimenting all across the campus with hybrid workplaces where people can work at home a certain number of days and in the office a certain number of days, depending upon the nature, again, of their work. And again, with decisions made locally. So that September 13th announcement was specific to Michigan Medicine. Individual units across the campus can make similar decisions on their own based on the needs of delivering on the mission of the university. Let me ask another question to Dr. Ernst. How will potential new guidelines about vaccine boosters be handled as policy and operational matters? We're getting lots of questions about boosters.
Yeah, and this is a very active issue, as Dr. Martin alluded to as well. The CDC has already issued some guidance around individuals with immunocompromised states, and that's would be really we've discussed, and it would be really challenging, and we're not prepared to incorporate medical history into the mandate kind of language. But if and when it perhaps becomes the case where all of us are expected to receive booster shots, that's something we'd have to consider. There's been public health officials talking about 8 months after someone's fully vaccinated as a consideration, but the advisory committee for immunization practices at the CDC has not issued guidance yet. So it's still not, the practice isn't even in place to first put in the operational steps to provide the vaccines, much less to extend the mandate. We will certainly be watching it closely. I think if it lands the way we think it might with 8 months, that will sort of sequence the folks through boosters sort of the same way that people were sequenced through the first go around. So healthcare providers, many in our community probably are, approaching or past the 8 months, but probably most of the campus people are still within that window until, Thanksgiving or later.
Good, thanks very much. And let me ask you one more question, Rob, that's coming up a lot. How do we plan to work with individuals who are denied a vaccine exemption, but still strongly believe they're unable to receive the vaccine, given we really haven't established an appeals process?
Yeah, I think this is where we'll, lean into the expert teams that we've configured with on the employee side. Those will become an HR and an occupational health, issue. And on the student side, those teams are composed of folks from the student life, including health service and including the Dean of Students office. So, there are already, even though there may not be a formal appeal process, I know a number of the medical ones aren't just sort of yes, no, they're requests for more information and sort of ongoing assessments. And I think these will be a case by case, situation, but they may ultimately become disciplinary or HR issues.
Good. And let me bring Martino Harmon back for what I think will have to be the last question. Martino, quarantine housing spaces, how many are available this year? And what's the rationale for having, it seems, fewer than we did last year?
Yes, so President Schlissel, we worked in our planning processes with public health professionals, and we set the max number at 288. That number is consistent with the maximum number of people students that we had in quarantine and isolation through last year in the worst periods of time without vaccination. So with a large percentage of our student community, in the residence halls, as we know, 99%, and we're approaching over 90% student body, we felt that number, that max level number would be appropriate. If we do see cases rising and we have to pivot, we're already investigating other alternatives to find additional spaces if need be. And then just to mention too, our quarantine and isolation service and coordination center is open just like in the past, so we can provide the same level of care and support.
Thanks very much. And let's squeeze in one more quick one with Rich Holcomb. Rich, what leave times are still available to staff and faculty if they need time off due to COVID? For example, if they're testing positive or need to provide care or childcare or quarantine or school kids, et cetera.
Yes, there's a table that we've created that's on the HR website that we can post a link to that after today's meeting that lists a number of different types of scenarios. So if somebody's unable to work due to illness themselves, if it's childcare issues, if they need to quarantine, what are the different categories or opportunities for time off? So we can post that after today's meeting so folks can reference that for their specific situation.
Very good, thanks. So we're just about at the hour, so I'd like to thank my colleagues who participated today, not just for today, of course, but for their ongoing intense efforts to try to keep our community safe and keep our mission going. A real welcome back to our students. I've been out on the campus. I walked near West Quad the other day where students and families were moving in. There was that sense of energy and joy that was simply absent last year. And it was very heartening to see. I hosted an ice cream social in the backyard of the president's house yesterday afternoon. We had hundreds and hundreds of students and their families come, enjoy some ice cream, meet one another, say hi. I know there were movies out on the Diag last night. It's really wonderful to see the campus come back to life. Let me continue to encourage everyone to do their own part by getting fully compliant with our vaccination policies. We've talked about that a lot today, and that's going to be a real key. By wearing masks indoors, that includes the big house. So we are having football the week after this. And outdoors, we're going to recommend masking. Indoors, we're going to require it. So please comply with that. And have a great semester. I think better days are ahead. Challenges are still ahead as we work towards a new normal. Thanks very much. Have a great weekend and go blue.